Okay, hi, my name is Madison. I'm a nursing student. I'm going to be doing a neurological assessment on you today, if that's okay.
Yes.
Okay, can I get your name and date of birth?
Catherine Parrott, November 8th, 1958.
Okay, very good. Catherine, do you have any allergies?
No.
Okay, and so for this assessment, I'm just going to be testing some of your senses like your sight, checking your balance, your sensation, stuff like that. So if you feel any pain or discomfort, just let me know.
Will do.
Okay, so patient is sitting erect with good posture, appears to have good hygiene, appears stated age, no facial droop noted, appears to be alert and oriented, has movement of all extremities and even pigmentation throughout. And then, so I'm just gonna ask you some questions. Have you had any head or spinal injuries?
No.
And then have you been having recurrent headaches or loss of consciousness?
No.
Have you been feeling any sensation of tingling in your arms or legs?
No.
And then do you have any history of high blood pressure or diabetes?
No.
And then do you smoke or drink?
I drink, I do not smoke.
And then how many drinks per week would you say you do?
I'd say 3 glasses of wine per week,
And how much is a glass of wine?
like 4 ounces.
Okay. And then do you have any family history of Parkinson's, seizures, diabetes, any other neurological
No.
diseases? No?
No.
Okay, now we're gonna get started. I'm gonna assess for your orientation. So do you know where you are?
I'm at the hospital
And do you know why you're here?
for a neurological assessment.
And then can you state the date?
April 22nd, 2020.
And then can you give me your full name?
Catherine Marie Parrott.
Okay, patient is alert and oriented ×4. Facial expression is neutral. Behavior is appropriate for situation. Affect seems to be normal. Now I'm going to assess for pain. So if you're feeling any pain, could you rate it from 0 to 10? 0 being no pain at all, 10 being like you just broke your leg.
0.
Okay. Patient states she has no pain. But if she did have pain, I'd go through old carts with her to assess like onset, when it, how long she's been having it, stuff like that. So now I'm going to start. So now I'm going to inspect your head. So no abnormalities or lesions noted indicating a head injury. Facial expression is neutral. Face is symmetrical bilaterally. No facial droop noted. So now I'm going to assess some of your cranial nerves. So first I'm going to do cranial nerve 7, which is her facial nerve. And so for that, can I just have you smile, raise your eyebrows, puff out your cheeks. Okay, facial movements were smooth and symmetrical, indicating a grossly intact facial nerve. Now I'm going to assess your trigeminal nerve, which is your 5th cranial nerve. And so for this, I'm just going to have you close your eyes, and I'm going to sweep this cotton ball across your face in different locations, and you're just going to indicate where you feel the cotton ball.
Forehead. Cheek. Cheek. Chin. Forehead. Chin.
Okay. Trigeminal nerve is grossly intact. So now I'm going to assess for her vagus and glossopharyngeal cranial nerves, which is cranial nerve 10 and 9. And so for that, I'm just going to grab my flashlight, and I'm going to have you say "ah," and open your mouth, say "ah," stick out your tongue. One more time. Okay, uvula moves in an upward motion and is midline. And now I'm going to do your assess for your hypoglossal nerve, which is your cranial nerve 12. And so for that, I'm just going to have you, can you repeat after me, light, tight, and dynamite?
Light, tight, and dynamite.
And then can I have you stick out your tongue? Move it side to side. So tongue is midline. Patient was able to clearly state light, tight, and dynamite, indicating the hypoglossal nerve is intact, grossly intact. And then now I'm gonna assess your spinal accessory cranial nerve, which is your cranial nerve number 11. So I'm gonna have you shrug your shoulders and then move your head against my hand with some resistance. Okay. The spinal accessory nerve is grossly intact. And so now I'm just going to assess your second cranial nerve, which is your optic nerve. Can I just have you read off this paper, that first sentence right there?
This year's 4th of July holiday in Petaluma is guaranteed to look and sound entirely different than years past.
Okay, very good. The optic nerve is grossly intact. And now I'm going to assess the third cranial nerve, which is the ocular motor nerve. So I'm just going to shine this flashlight in your eye to assess your pupils. So just look at my nose. Okay. Let me do this side one more time. Okay. Pupils are equal, round, and reactive. And now I'm going to assess your cranial nerves 3, 4, and 6, which are your ocular motor, trochlear, and abducens nerve. And so for that, I'm just going to have you follow my finger. So don't move your head, just move your eyes. Okay. Eye movements were smooth and rhythmical and symmetrical. No nystagmus noted, indicating that all 3 cranial nerves were grossly intact. And so now I'm just going to assess your kinesthetic sensation. So I'm going to have you relax your hands, and I'm just going to have you close your eyes, and I'm going to move your fingers either up or down, and you're going to tell me which way I'm moving them.
Up, down, up, down, up, down, down, up.
Okay, now I'm going to do it on her toes. I'm just going to move the camera down. Close your eyes again, please.
Up, up, down, 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 up.
Okay, kinesthetic sensation is intact. I'm just going to grab some more hand sanitizer. And then now I'm going to assess your gross sensation. So I'm just going to basically palpate your arms and just see if you can feel it. So just close your eyes. Can you feel that?
Yep.
Can you feel this?
Yep.
Okay, I'm going to do your legs now.
Yeah.
Can you feel that?
Yep.
Okay, and this side. Can you feel that?
Yep.
So gross sensation is intact in upper and lower extremities. And then for the last test, I'm just going to assess you for your balance. So can I have you stand up? And then can I have you walk heel to toe towards me? Okay, very good. And then now I'm going to do the Romberg test for balance. So can I just have you stand there with your feet together, arms at sides, and close your eyes? Okay, now open. Okay, balance was good, no swaying or missteps when doing the heel to toe walk or the Romberg test. Romberg test is negative. And so that concludes my assessment today. So if you have any questions, just let me know.
Will do. Thank you very much, Madison.
Yeah.